She woke up one morning feeling tired. Her back hurt a little, some mild cramping, and she almost talked herself out of calling her doctor. It's probably nothing, that I'm just pregnant and I don't want to be that patient. But she texted anyway, and her doctor said, "Come in." And within hours she was hooked up to a monitor at 32 weeks pregnant and in active labor. She was not being dramatic, she was not anxious, she was not overreacting. Her body was sending a signal, and she was brave enough to listen. Now I want you to think about how many times you have felt something off, something not quite right, and talked yourself out of it. That I'm just tired, that I just had a baby, that I'm probably being too sensitive, that I don't want to bother anyone. Today we are going to talk about 3 things that happen to women's bodies before, during, and after pregnancy that the medical system consistently underestimates. We are going to talk about PCOS, the hormonal condition affecting 1 in 10 women that goes undiagnosed in 75 to 90% of cases. We are going to talk about preterm labor, and what 6 weeks of contractions while trying to keep your baby in actually costs a woman. And we are going to talk about postpartum preeclampsia, a potentially life-threatening condition that most women have never heard of, that can strike up to 6 weeks after your baby is born. If this is the kind of conversation you have been waiting for someone to have, you are in the right place. And if this channel is new to you, hit that subscribe button and turn on notifications, because every week we bring you exactly this, the science, the story, and the tools that nobody else is talking about. Now let's get into it. Part 1. PCOS, the condition hiding behind normal teenage problems. Why 75 to 90% of women with PCOS never get diagnosed. Picture a 15-year-old girl sitting in a gynecologist's office. She has terrible acne. Her weight fluctuates in ways that don't seem connected to what she eats. She feels moody, deeply, persistently moody, in a way that goes beyond normal teenage emotion. And she came in for a routine checkup. She didn't even know she was allowed to mention the things that were actually making her miserable. That is the story of so many young women with PCOS. They don't connect the dots because no one has ever given them the picture those dots are supposed to make. So let me give you that picture. PCOS, polycystic ovarian syndrome, is a hormonal condition that affects approximately 1 in 10 women. It is one of the leading causes of infertility. It is associated with insulin resistance, elevated androgens, and a constellation of symptoms that can look completely different from one woman to the next. 1 woman has severe acne. Another has hair loss. 1 has facial or body hair. Another struggles with irregular periods. 1 has significant weight gain despite eating carefully and exercising consistently. Another has mood disorders, anxiety, depression that seem to have no clear cause, because the symptoms vary so widely, and because many of them individually are easy to dismiss as normal. PCOS goes undiagnosed in an estimated 75 to 90% of women who have it. At 75 to 90%. That is not a minor oversight. That is a systemic failure to recognize one of the most common hormonal conditions affecting women, and the cost of that failure is enormous. Think about the young girls who are told to eat less and exercise more, when their body is metabolically incapable of responding to those instructions the way a body without insulin resistance can. Think about the girls who develop eating disorders, because the only message they have ever received is that their body is doing something wrong that they should be able to fix. Think about the women who spend years trying to conceive, not knowing that an undiagnosed, untreated hormonal condition has been quietly affecting their egg quality the entire time. Here is what insulin resistance, the underlying driver of most PCOS, actually means in plain language. Your body produces insulin in response to the food you eat. In someone without insulin resistance, that insulin does its job efficiently. Blood sugar is processed and stabilized. In someone with insulin resistance, that process is less efficient. The body compensates by producing more insulin, and elevated insulin drives elevated androgens, the testosterone-like hormones that cause acne, hair changes, and the hormonal chaos that defines so much of PCOS. It is not a willpower problem. It is not a discipline problem. It is a metabolic problem, with real treatable causes that requires real informed care. What does treatment look like? For younger women, low-dose birth control pills can regulate cycles and reduce free testosterone. Spironolactone, an anti-androgen medication, can further reduce testosterone-driven symptoms. Metformin addresses insulin resistance directly, particularly when fertility is a goal. And for women with more significant weight concerns, GLP-1 medications have shown remarkable results in PCOS patients, not just for weight, but for the insulin dysregulation that drives the condition. Lifestyle, low carbohydrate eating, regular movement, Inflammatory nutrition is always foundational. Though it is rarely sufficient on its own. One critical fertility note. PCOS patients often have many more follicles than average. That can look reassuring on an ultrasound, but quantity is not the same as quality. After age 30, egg quality in PCOS patients can decline more quickly than in women without the condition. An ultrasound that shows many folliculitis, not a green light. Delay fertility planning. Takeaway number 1. If you are a woman at any age who has irregular periods, persistent acne, unexplained weight struggles, mood instability, or a family history of diabetes, bring the word PCOS to your next doctor's appointment. Ask to be evaluated. Ask for blood work, including testosterone and insulin markers. Do not wait for a doctor to bring it up, because most of the time they won't. Part 2. 6 weeks of contractions. What preterm labor actually costs a woman. The part of pregnancy nobody talks about. She woke up at 32 weeks pregnant feeling tired. Back pain. A little crampy. And she almost convinced herself it was just one of those days, but she texted her doctor, and her doctor said come in. And within hours she was in active labor. 32 weeks. 8 weeks before her due date. She did not go home that day. She spent 6 nights in the hospital, and then she went home on bed rest, still contracting for the next 6 weeks. Let me describe what that looks like. Contracting every day for 6 weeks. Not knowing if today was going to be the day her baby came too early. Not knowing if the next wave would be the one that couldn't be stopped. Living in the particular terror off a body in a permanent state off almost, but not yet, and maybe today. The medical team's goal was simple and was stated clearly. Every week matters. Every week that baby stays inside us, another week of lung development, brain development, weight gain, readiness for the world. The goal was not comfort. The goal was time. She made it to 38 weeks. Her daughter was born healthy. And when it was over, she said, I did that. 6 weeks of contractions. And I did it. I want to hold that for a moment, because we talk so much about the delivery, the birth story, the moment of arrival, but we almost never talk about the 6 weeks that preceded it for women like her. The 6 weeks of uncertainty. Of monitoring. Of medication. Of lying still while her body insisted on moving in a direction she needed it not to go. The emotional cost of that is real. The physical cost is real. And it deserves to be named, not swept into everything worked out fine. Because even when everything works out fine, the woman on the other side is carrying something that she needs space to put down. What can you watch for? Contractions before 37 weeks, even mild ones, that are regular or intensifying. Lower back pain that comes and goes rhythmically, pelvic pressure that feels different from the usual discomfort of pregnancy, the general feeling that something is different today. Takeaway number 2. If you are pregnant and something feels off, contact your care provider. Not tomorrow. Not after you see if it gets worse. Now, because she almost talked herself out of reaching out. And if she had, her daughter might have arrived 8 weeks early. Your gut is not anxiety. Your gut is data. Treat it accordingly. Before we go any further, I just want to take one breath and say something to you. If you are watching this and something is landing, something is clicking, something is making you think, I wish someone had told me this sooner, that is exactly why we make these videos. And if this kind of content matters to you, the most meaningful thing you can do is hit the like button right now. It takes 1 second. And it helps this information reach the woman who needs it most, the one who hasn't found this channel yet. And if you are not subscribed, please do that too, because next week we are going to go even deeper into the conversations that the healthcare system has not been willing to have with you. You deserve that. Now let's keep going. Part 3. Postpartum Preeclampsia. The condition that strikes after you think you're safe. What every postpartum woman needs to know: she gave birth. Her daughter was healthy. Her delivery was smooth. She went home. She held her baby. She watched her baby on a monitor because she could not sleep knowing her daughter was somewhere in the world and she was not watching. And then she started to swell. Not a little. Like a balloon. Full body. Her husband pressed his finger into her foot, and the indentation stayed. She felt wrong. Not tired. Not sore. Wrong. Like she was having conversations but wasn't really home inside them. Like her body was present but something else wasn't. She texted her doctor. Her doctor sent a nurse. Her blood pressure was 165/103. That is a hypertensive emergency. That is the kind of number that, left untreated, leads to seizure, to stroke, to catastrophic outcomes for a woman who just gave birth and went home believing the hardest part was behind her. She was readmitted to the hospital 2 days after delivering her baby. She left her newborn daughter. She spent 24 hours on a magnesium drip. She lost 25 pounds of fluid retention in 48 hours. She was placed on blood pressure medication for 6 to 8 weeks. And she described it as one of the hardest things she has ever had to do. What is postpartum preeclampsia? Most people have heard of preeclampsia, the high blood pressure condition that can develop during pregnancy. What almost no one knows is that preeclampsia can develop after delivery. Women are at risk for up to 6 weeks postpartum. It can appear with no warning. It can appear in women who had completely normal blood pressure throughout their entire pregnancy. And it can be life-threatening if not caught and treated quickly. Symptoms to watch for: severe headache that does not respond to medication, visual changes, blurring, flashing lights, spots, upper right quadrant pain just below the ribs on the right side, sudden significant swelling, particularly in the face, hands, and feet, and perhaps most importantly, a general feeling that something is wrong, that you are not home inside your own body, that this is different from tired, that this is not okay. She did not have the textbook symptoms. What she had was a feeling, a persistent, undeniable feeling that something was wrong. And she was right. She was always right. This is why the message, "If you don't feel well, say so," is not just reassuring advice. It is a medical instruction. Because not every dangerous condition announces itself with classic symptoms. Sometimes the only symptom is a woman's own knowledge of her own body. And that knowledge deserves to be taken seriously. By her doctor. By her partner. And most importantly, by her. Takeaway number 3. In the 6 weeks after you give birth, you are still at risk. If you experience sudden swelling, severe headache, visual changes, upper abdominal pain, or simply a feeling that something is wrong, do not wait. Postpartum preeclampsia is treatable, but only if someone catches it. And the person most likely to catch it first is you. Part 4. The recovery. No one romanticizes what postpartum actually looks like, and how to come back slowly. She came home from the hospital for the second time. Baby in arms. Blood pressure medication in hand. The medicated feeling sluggish, heavy, not quite herself. Stretched for 6 to 8 weeks. And the mom guilt arrived almost immediately. She described the tension between needing support and wanting to be the one who did everything. Between accepting help and feeling like accepting help meant she was missing something. Between being a first-time mother who didn't know what she was doing, and being completely unwilling to miss a single moment. This tension is so common, and so rarely named. Here is what she did that I think is worth paying attention to. Month 1, she healed. Nothing else. She did not exercise. She did not focus on weight. She ate nourishing foods. And she let her body rest. Completely. Without apology. Month 2, she walked. Morning and evening. With her baby. Not for weight loss. For herself. For the air and the movement that helped her brain as much as her body. Month 3, she added Pilates. Once she was medically cleared. Gentle at first. Building slowly. She lost approximately 50 pounds in 3.5 months. Most of it in the first 3.5 weeks because most of it was fluid. Not through restriction. Not through punishing exercise. Through healing. Through time. Through trusting her body to do what bodies do when you stop fighting them and start supporting them. A note about PCOS and postpartum recovery. For women with PCOS, the postpartum period can be particularly complex. The insulin resistance that drives PCOS does not disappear with delivery. This is not the time to restrict aggressively. This is the time to eat in ways that support blood sugar stability. Protein first, complex carbohydrates, healthy fats, minimal refined sugar, and to move gently and consistently as the body allows. Takeaway number 4. Postpartum recovery is not linear. It is not a return to a previous version of yourself. It is the slow construction of a new one. Give your body the first month to simply heal. Not to bounce back. Not to lose weight. To heal. Everything else can wait. Part 5. The relationship that made everything possible. What secure love actually looks like in the hardest moments. I want to close with something that runs underneath everything we have talked about today. Because health does not happen in isolation. She described finding her partner in a way that I think is one of the most honest, most useful things I have ever heard anyone say about love. In all my previous relationships, I found myself changing to be the right person for that person. With him, I was just completely myself. And he loved it. He magnifies me as a person rather than trying to change me. There it is. That is secure attachment. That is what it feels like from the inside. Not the absence of challenge. Not the absence of hard days. But the presence of a person who sees who you actually are, not who they wish you would be, and chooses that. Every day. She described lying in a hospital bed at 32 weeks pregnant, contracting, terrified, and her husband texting her doctor at every turn, coordinating, advocating, not knowing what to do but refusing to do nothing. She described being readmitted to the hospital 2 days after giving birth, leaving her newborn, and him driving her, because her doctor said it was not safe for her to stay home. Secure love in a health crisis does not look like grand gestures. It looks like someone who notices, someone who takes action even when they are scared, someone who makes sure their person is safe, even when that means being the one to drive her back to the hospital 2 days after she came home. And for women, the lesson goes even deeper, because she almost talked herself out of every single one of these moments, almost convinced herself the contractions were nothing, almost told herself the swelling was normal, almost let mom guilt override the clear signal from her body that something was wrong. Secure love also means loving yourself enough to trust what you feel, to say out loud, "I don't feel well," and to mean it, and to act on it, even when the voice in your head says don't be dramatic, even when the world around you says you just had a baby, because every time she said "I don't feel well," she was right. Every single time. Takeaway number 5, trust yourself. Not just as a mother, not just as a patient, as a woman. Your body is speaking to you constantly. It is giving you information that no test, no scan, no blood panel can replicate. And the most important thing you can do for your health, and for the people who love you, is to listen. So let's come back to where we started. A woman, waking up at 32 weeks pregnant, tired, achy, a little crampy, and almost talking herself out of reaching out. She reached out anyway, and her doctor listened, and her daughter came home healthy. And 2 days after she gave birth, when her body said something is wrong, she listened again. Even through the mom guilt, even through the exhaustion, even through the voice that said maybe it's nothing. It was not nothing. It was never nothing. It was always her body, speaking clearly, consistently, reliably, and a woman who had learned slowly and imperfectly to trust that voice more than the noise around it. Here is what I want you to carry from everything we talked about today. 1. PCOS affects 1 in 10 women and goes undiagnosed in up to 90% of cases. If you have irregular periods, persistent acne, unexplained weight struggles, or a family history of diabetes, ask your doctor about PCOS. By name. Today. 2. Preterm labor does not always announce itself dramatically. If you are pregnant and something feels different, contact your care provider. Your gut is data. Treat it that way. 3. Postpartum preeclampsia can develop up to 6 weeks after delivery. If you experience sudden swelling, severe headache, visual changes, or simply a feeling that something is wrong, do not wait. 4. Give your body the first month after birth to simply heal, not to bounce back. To heal. Everything else can wait. 5. Trust yourself. Your body knows things before your brain catches up. When it says "I don't feel well," please listen. And here is the thread that connects all of this to everything we talk about on this channel. Secure attachment, the kind that holds you when everything else is uncertain, starts with being securely attached to yourself, to your own experience, to your own knowledge of your own body. The most important relationship you will ever build is the one between you and your own inner signal. Tend to that relationship. Trust it. Advocate for it. And surround yourself with people, partners, doctors, friends, who take it as seriously as you do. If this video gave you something today, a word you needed, a piece of information that finally made something click, drop a comment below and tell me. Has your body ever tried to tell you something, and you almost didn't listen? What happened when you finally did? I read every single comment. And this community, the people who show up here every week, they read them too. You are not alone in any part of this. And if you know a woman who might be living with undiagnosed PCOS, or who is pregnant and feeling dismissed, or who is postpartum and not quite right, please share this video with her. because 75 to 90% of women with PCOS never receive a diagnosis. And you might be the reason one of them finally does. If you are not subscribed yet, this is your sign. Hit subscribe, turn on the bell, and I will see you right here next week. Thank you so much for being here. I'll see you then. Blue Heart.